Welcome, everybody. This is a Burnaby Primary Care Network's Doc Talks. Today we'll be focusing on the Be Well program, a program within the Burnaby Primary Care Network's Be Well Positive Habits for Health. Just as a reminder, this session is being recorded and will be made available to not only to participants but to others afterward on the burnabypcn.ca website, where many of the other Doc Talks are also available. So if you'd like to see it afterwards, it will be there. Usually it takes a few days to get it up, but you'll have an opportunity to see it and also share it with your friends and your family. I also wanted to mention that the burnabypcn.ca website has quite a broad and deep catalog of resources around health and well-being in Burnaby, including both social supports and health and wellness supports, and many of the other programs that are part of the Burnaby Primary Care Network. So the Be Well program is a chronic disease preventative health program that was launched by the Burnaby Primary Care Network in October of 2020 and is really taken off. It's been a really successful program, and of course it includes behavioral health coaches under the supervision of a clinical psychologist who we're lucky enough to have here today. You'll hear more about it. I think it's been both successful and timely, certainly in times of COVID when our levels of stress are higher than we've ever expected. So we're really fortunate to have Dr. Sandra Thompson with us today. She completed her PhD in psychology from the University of Manitoba. She's worked in a number of settings, providing psychological consultation, assessment, and treatment services. Dr. Thompson's been an instructor of numerous university level courses. She was an assistant professor and clinical psychologist in the Department of Clinical Health Psychology and Faculty of Medicine at the University of Manitoba from 2010 to 2017. During that time, she served as supervising psychologist of pre-doctoral residents in the rural rotation and instructed medical students in the area of adolescent development, domestic violence, and motivational interviewing. In 2017, she and her family returned to Cranbrook, BC, where she currently has a small private practice, primarily for assessment and treatment for individuals exposed to traumatic events. She has a special interest in mindfulness and communication to improve overall mental health and well-being. And welcome, Dr. Thompson. It's really great to have you here.
Oh, thank you very much, Jeff. It is great to be here to talk about all the great work that the Be Well service are doing in Burnaby. And thank you for the introduction and the opportunity to speak here today. So as Jeff mentioned, I just recently returned to British Columbia in 2017. And shortly after, unfortunately, very tragically, my husband was diagnosed with terminal cancer within a year of us returning to BC. And sadly, he passed away in July of 2020 after a 2-year illness. So when the opportunity to work with this new service in primary care came up, it really looked like such a great opportunity for me, as I've all too well know the impact of chronic disease on families. So I've been very grateful to work with the wonderful people in Burnaby and have the chance to implement this for the first time in primary care. I've also been very privileged to work with Dr. Leslie Lutz, who is a big advocate in promoting positive health changes in British Columbia. She's done 20 decades of research in the area of obesity, weight management, which I'm going to be speaking about today. So the talk today is going to cover that, a lot of what Dr. Lutz has been working in terms of the area of obesity in our society, and then her research and what she's developed in terms of small changes in order to help manage these chronic health conditions that are within our primary care populations. So as an intro, the small changes is a lifestyle intervention. And this is the first of its kind, really, in probably in Canada, for sure in BC, which is evidence-based, effective, and it really translates to people's lives. So what I'm going to do today is talk about the sort of the basis for this. And then I'm going to talk about the small changes approach, and then give you an idea of over the first year in implementing it in Burnaby, some of the outcomes that we've been finding, which is very consistent with the research of Dr. Lutz. So just as a setting the stage, we definitely have an obesity epidemic. It's doubled in countries all over the world, really. And so it's something that I think within healthcare, we need to be taking quite seriously. So what obesity is: an elevated body mass index, which is a height weight ratio. It's associated with a number of diseases, chronic cardiovascular disease, diabetes, obesity, and it's also linked to cancer. And during COVID-19, I think this has highlighted the importance of targeting obesity, in the fact that for 92% of the hospitalizations for COVID-19, patients have had at least one underlying health condition like obesity. And obesity, in fact, triples the rate of hospitalizations for COVID, and also increases the risk of ICU admissions, those invasive mechanical ventilations, and death increases with higher BMIs. And then, of course, COVID has disproportionately affected racial, ethnic minorities, women, and people living with disabilities or mental illnesses. And these folks tend to have less access to evidence-based preventative care, which is a big reason for having this in our primary care system. So obesity in Canada, 60% of Canadians have either are overweight or fall into the obesity category, based on the BMI that I was speaking about. And the costs are increasing from 5 to 7 billion to now potentially 9 billion. So people with lower education and increased age are at increased risk for obesity. And in a lot of the studies out there, this is probably the number one issue facing Canadians. It's tied to a number of medical and psychological complications, morbidity, and in fact, mortality. Cancer and heart disease accounts for 50% of deaths in Canada annually. Heart disease is the number 2 killer in Canada, and 6 out of 10 leading causes of death in Canada are related to what are non-communicable diseases. So these more chronic types of health conditions. Weight status, again, the BMI is now linked to 12 different types of cancer, which is the number 1 killer in Canada. A lot of these types of conditions are linked to certain lifestyles, certain behaviors. The risk factors for these non-communicable diseases like cardiovascular disease, these more health-related, are increased tobacco use period, alcohol, physical inactivity, and then of course unhealthy diets. And 2 out of 5 Canadians will have at least one of these types of conditions. 4 to 5 are at risk for developing a chronic condition, and it's costing Canada in terms of healthcare spending about $68 billion. So definitely worth a look. As Jeff alluded to, during COVID-19, individuals generally are on a trajectory of weight gain overall. This is in fact increased even further during COVID-19, the isolation and the impact of the stress of the pandemic. Additionally, the mental health of Canadians, British Columbians, has also declined during the time of COVID-19. One of the ways that people try to manage obesity, manage their weight, is through dieting. Diets have been around forever, and it's essentially a $72 billion kind of industry, in the sense that there's a lot of money in the diet industry in terms of weight loss and diet control. So what we know, though, is that people do not need another diet. So this is Dr. Leslie Lutz, again, 20 years of research in obesity management. And her quote is that people don't need another diet. They need us to radically change our approach towards effective treatment so that it's realistic, sustainable, generalizable, and encompasses the whole person, so that it can help them improve their health and well-being. And So that is the premise and the philosophy behind the small changes approach as a way of managing the obesity epidemic that we are seeing in our healthcare system. So what is the small changes approach? What does it consist of? It's a chronic disease prevention health approach. So it looks at how can we prevent chronic diseases before they actually even happen. Again, it was developed by Dr. Lutz in around 2000. So this has been probably 2 decades of research. And as she states, it takes often 17 years before research actually hits the ground and becomes practice. So over 2 decades of research, her small changes approach has actually shown effectiveness in terms of managing individuals' weight in terms of obesity. The core component of it is that it deals with the whole person. It's not a diet. And the small changes, the small acronym is based around goals, individuals setting their own health goals, health behavior goals that are self-selected. So they're chosen by the patient or the client. They're measurable. We know that this is the most effective way for behavior change. They're action-oriented. So they create a sense of agency, or people then feel they're doing something toward improving their own health. The L is linked to your own life. This is something that is really important for setting goals, because oftentimes people will set goals that aren't doable. And so we really encourage people to make it so that it fits within their lifestyle. And it's limited in time, so you can try it for a while, and then if it doesn't seem to be sticking, then certainly tweak it, change it, modify it in a way that will work in your life. So again, the core premise, or the main principle of the small changes, it's not a diet. It's not a temporary way of life, which is often what diets tend to be. The program has no forbidden foods. There aren't foods that you can't eat. And what it is, it's about making lifestyle changes, again, that fit for your life. It's moving towards foods that nurture and bring you joy, and moving towards activities that help you feel better, increase your energy, and help you to manage your stress. We work with individuals to separate food and emotion in terms of more mindful eating. We help people see that every situation is their choice, their own choice in terms of what they want to do. There are no diet rules, and we address a number of other factors in the individual's life, including social supports, their relationships, their thoughts, cues in their environment. So we really look at the wholeness of their life and not just what they're eating. So it combines, what Small Changes does is it combines the elements of, say, traditional behavioral therapy and giving behavior choice. It's non-dieting. It's a psychological treatment approach, which kind of brings together a number of different theories, allowing participants to set goals that are small, so not big, only one at a time, so more is not better. And the key is that it has to be relative to where they're at, to what their baseline is. There's no gold standard as to what they have to do or what they should do. It really is relative to where they're starting from in their life. We really focus on client behaviors, less so on weight and the health improvements in terms of blood sugar, all of those things. Those will come with time. The target is always on the behaviors that they're doing in their lives day to day. And then we also help them with skills in dealing with their emotions and the environments and the other factors that are definitely involved and impact their ability to manage their weight. There goes that bird. So this is a visual we use to sort of demonstrate why it's important to do things in smaller ways. We're much more successful if we make our goals achievable than if we aren't able to reach something. It's not that realistic to try to make that a goal. So this visual we use as a an example of how small changes can be extremely beneficial to people in their lives. As I mentioned, Dr. Lutz has done countless studies, countless trials, research trials, which have consistently shown support for this approach in promoting weight loss, and not only weight loss, but also sustained weight loss in individuals in all kinds of different populations, veterans to number of populations in the States, and consistently shows that small changes is a very effective way to help people manage their weight and sustain that change over time. So just to sort of wrap up in terms of kind of the small changes, Jane Procrasta talks a lot. There's a lot of talk about this now, that our culture often will give people two options: take big action or do nothing. So that is often the pendulum, where the pendulum will swing, is that people will do all and then they'll swing back to nothing, feeling discouraged because all definitely isn't going to last, and it ultimately fails. So basically people then become quite discouraged and demoralized and go back to doing nothing. Dr. Mazafarian, who works in the area of nutrition, comments that it's the rare individual that can make a dramatic lifestyle change and then stick to that very quickly. It's not the way that we are wired to be able to do that. So recognizing these all or nothing approaches to dieting and to managing weight are not effective. And in fact, this was just published in the New York Times just this last month, this year, that there's mounting evidence to suggest that diets really don't work. I think more and more people are realizing that. Research consistently shows that food restriction makes people want to eat more. And over the long term, dieting can actually backfire, triggering your body's survival defenses. And what that does is slow your metabolism down over time, making it more difficult to in fact lose weight in the future. So that sets the stage for Be Well. Where did Be Well come from? Now I'm going to talk about the year of Be Well in the Burnaby Primary Care Network. So in 2020, the Burnaby PCN partnered with Dr. Lutz to bring the program into the system. Again, it's a chronic disease prevention health service, and we provide coaching to individuals who are at risk for or in the early stages of chronic disease. And these can be things from obesity, cardiac concerns, diabetes, high cholesterol. And we offer an evidence-based holistic approach. As I just talked about, we help people with their entirety of their lives, not just their nutrition, for example. And as I've already stressed, we help clients to reach their own self-directed lifestyle goals. We really want to meet people where they're at and help them from where they're starting and not have expectations around where they should be or what they should be doing. We really are there to help them and meet them where they're at. So our health coaches, what do they provide? Currently, we're providing a combination of both group and individual health coaching on lifestyle and behavior change, which consists of, at the core of what we do is a non-judgmental approach with individuals. Oftentimes, when people have come into our service, they've had long-standing issues and concerns with weight and weight management. And with that, as I've already talked about, comes a lot of discouragement, disappointment, feeling deflated. So we really allow for space for them to just talk about their experience, provide them with some support over long term, so that the health changes that they make are monitored and sustainable. We provide them with the opportunity to determine their own goals. Again, we meet them where they're at, that you as the client will set the goals that fit in your life. Part of our service, because we have a number of content areas that we've developed as well, we increase skills in mindful eating, communication, social support, stress management. These are just a few of the topics that we cover as part of our service. Additionally, we are we are looping back to the physician regularly and to the client and giving feedback as to how their progress, how they're doing in terms of meeting their health goals. And lastly, we also help to identify other supports and resources. As I said, we look at the person's life, not just their diet or their activity. So we're able to sort of reach out and bridge for them and help them find other supports and resources that they actually might be needing in addition to Be Well coaching. This is our session content. So part of developing the service, we developed materials to provide to all of our participants, in addition to giving them a pedometer if they don't have a way of tracking their activity. So this is just this gives you a sense of what we cover. We cover the power of kind of starting small. We cover nutrition, movement, thoughts, habits, communication, social support, mindful eating, body image, stress, sleep, problem solving. And then near the end, we also cover prevention, next steps, and how can they check in with themselves over time to make sure that they're not drifting or falling away from the health goals that they've already established. This I'm going to cover fairly quickly. This is just what we do as part of the service as well is track information. We track how many referrals, we track a lot of outcomes with our clients as a way of determining how effective our service is. We really want to be sure that we're meeting targets, that we're helping people in the ways that they're hoping for. So just to give you a sense, in the year we received 175 referrals. Of those 118, we got what we call baseline assessments. And I'm just going to run through very quickly these folks then go through our treatment, go through the service, and then we provide outcome measures. I have some outcome measures for 70 of these individuals, and then I have outcome measures for 18 after completing the full year of Be Well. So I'm just going to run through this fairly quickly. Psychologists love outcome data. But it's important to demonstrate that during COVID-19, running everything virtually, the impact that the service was able to have on individuals. Just some demographics. Our mean age is roughly around 51. The mean BMI was 32 is an obese class 2. And the number of health conditions that these 70 individuals on average was over 3, almost 3.5 health conditions when they came into our service. Very quickly again, mental health outcomes. These are outcomes of PHQ-9 is sort of mood or depressive symptoms. GAD, the GAD, is anxiety symptoms. And even in the first 3 months, individuals went from 9 to 6 in terms of scores, which is a reduction in depressive symptoms, and similarly for the GAD, 8 to 6. So even within 3 months, individuals were already showing improvement in their overall mental health. And again, this is during COVID. We have individuals track their activity through steps. Steps went from roughly 4,000, which is fairly inactive, but even within 3 months, they were showing an increase in activity to almost 6,000 steps per day on average. The first 3 months of treatment, people were already showing a weight loss of 1.686 kilograms, so almost 2 kilograms, so roughly 4 to 5 pounds. Similar this is our completed group. So these folks completed the full 12 months of our service and are now moving into our maintenance phase where we offer a monthly maintenance group. These 18 individuals, again, the average age was about 55. The BMI again was obese class 1. And the number of health conditions was roughly just over 3 already by the time they entered our service. I want to emphasize how much time treatment took over the course of 1 year. Each individual that was in our service averaged about 18 sessions across the year. So they met with a health coach approximately 18 times on average. Each session of health coaching is about 30 minutes, give or take. Again, this was all done virtually. So the treatment time was a total of probably 540 minutes of intervention over the course of 12 months for these individuals. Again, these are those mental health outcomes, so mood and anxiety. And from baseline, so from the coming into our service to the 1 year mark, those scores went down significantly, quite significantly, from sort of in the mild range to sort of really, just mild to this is considered very minimal anxiety, which was a really great thing to see, especially again during COVID, that there was such improvement in their mental health. Their steps nearly doubled. They went from an average of 3,500 all the way up to probably 6,500 steps on average per day. And in fact, as I said, we focus on behaviors, the weight change will come. The average for these 18 was 4.18 kilograms of weight loss over the course of the 12 months. And again, this is during COVID, when trajectory of weight is usually in terms of weight gain, not weight loss. So I just want to share a little bit about what physicians and nurse practitioners and patients are saying. We've had some really nice positive feedback from say, Dr. Lisa Tan, who says that Be Well is life-changing. Nurse practitioner Jennifer Wu really is grateful for the program's accessibility for patients. And then there's some quotes there for people to read, which is really nice to hear that individuals are finding it helpful and supportive to help them change their health in a way that's fitting for their life in such a positive way. So overall, just individuals are finding it of real benefit to help them stay on track and keep on track and stay motivated. So just to kind of give a summary, our preliminary results, as I just showed, so really positive health change in weight management. Individuals have increased their activity, and they've also, as I said, reduced mental health scores for both symptoms of depression and anxiety. With some new research that's come out, we've now shifted our service to a blended model. We're now offering both individual and group coaching. And then after that, individuals will be followed by a monthly maintenance group for up to 24 months total of support in order to provide that ongoing coaching and monitoring of health behavior changes. So this is sort of just a visual. So the way for individuals wanting to sort of more information, we get a referral from your GP or your nurse practitioner. We book an intake appointment with you, which usually takes roughly an hour for us to gather some information. Then you're given group coaching, which happens every 2 weeks. And then on the off weeks, you're given an individual coaching session by way of check-in to help you stay on track with your goal setting. Once you're completed that, the group portion, which is all the content information, then you can go into our long-term maintenance group for follow-up, where you can check in monthly to ensure that you're staying on track with all the health goals that you've achieved. This is just this is our new format. So the way we've set things up now is our first 4 sessions, we really like to sort of get grounded with someone individually. We do an intake appointment, give you sort of the information around what Be Well is and our philosophy around weight management. We talk about activity, and then we start with kind of getting you looking at nutrition and fuel. After that, that's when we start our group sessions. And we really want to start things off in a way that's kind. We start with a self-compassion module to help people to sort of soften with themselves. There's been a lot of probably judgment and harshness. So we really want people to come at this from a place of understanding and compassion and kindness. So, and then after that, we get into sort of the other sessions around all those different skills that I mentioned, from mindful eating to stress management, to stress, and so forth. So I have the great fortune to work with some amazing health coaches. Kyla and Paula are Edmonds health coaches. In Metrotown, we have Michelle and Shruthi. And in Hastings, Brentwood, Katie and Catherine are the health coaches for that neighborhood. I have also the great privilege of working with Miss Sophia Cow, who is another registered psychologist. She and I share the supervising psychologist position. So as I mentioned, I'm very grateful to be part of such a positive team who really are interested in helping Burnaby residents improve their health and well-being. And I think that is it. How is my time? Not bad. So I really encourage anyone who feels they could benefit from our service to talk to your primary care provider about a referral to us. We'd be happy to have you join our service to help you improve your health.
That's great. Thanks, Dr. Thompson. I'm going to encourage folks to put their questions in the Q&A. If you have some, I have some questions. So if maybe we can start with mine and see where we go from there. You did just at the end talk about the referral process, and I know you mentioned it, but just for clarity, do I need to have a family doctor in order to be able to access this service?
Yeah, unfortunately, you do need to have a Burnaby, there has to be a Burnaby physician or nurse practitioner. Yes.
Right. If I went to the urgent primary care center, would I be able to get a referral from there, or do you know?
Well, I think if they're a Burnaby physician, then likely, yes. Yeah.
Okay. Yeah. So
as long as they're tied to Burnaby. Yeah.
Yeah, and those are the urgent primary care center in Burnaby is all staffed by family doctors in Burnaby. So yeah, you could see how that might be a way to do that. And I was curious, you spoke to the kind of the demographics of the folks who've been accessing it. I wondered how closely that reflects the demographic of obesity in our community. Do you have any idea about that?
Well, we know with increased age, it's not uncommon, right? So the fact that our demographics are 50s, it makes sense, right? Because as people age, BMIs definitely do increase more in the middle age for sure. We have a range of folks, though. It's not, but that's our average, right? But
yeah,
we have young adults and then we have older. But yeah, that seems to be our kind of our mean. Yeah.
And it seemed to tend toward female, but my I guess visually I say, it seems to me like obesity is something that doesn't seem to be on a divided on a gender basis like that.
Yeah, we tend to. There's a few more females that access our services, but it doesn't reflect sort of the population. It's just to think who's maybe reaching out for services. Yeah.
Yeah, you wonder, but I'm kind of curious because I know we in some of this work that we do in the PCN, we talk about rising obesity rates, men in isolation, but also youth and teens, particularly around this, or young adults, particularly around the time of COVID when nobody's been able to go out and get any exercise. But I guess those are the folks that are the least likely to come to their doctor and talk about it.
Mm-hmm. Yeah.
Yes, just in terms of, is there a commitment from if I were to enter the Be Well program, what would my commitment be? What would you expect a commitment from folks, or is it a try it and see if you like it?
Well, we certainly have had some individuals who it may be not the right time for them in terms of sort of timing, and that happens, but we try to make it so that it doesn't take a lot of their time, right? We want to make sure that even if we're just doing very quick sessions with them, just to be touching point, it doesn't have to take a lot of their time. But ultimately, we'd love for them to stay for the duration, because we know that longer support means that they can, have more positive outcomes for sure. Yeah.
And does the program keep in touch with folks after the formal program is over? Do you have any mechanism for that?
We haven't at this stage. Again, we're fairly early, but there could be sort of an opportunity after the 24 months to touch base, yearly or something. But at this point, we haven't. But right now, we're offering up to, like I said, the 2 years. Yeah.
Yeah, that's great. And just in terms of sort of you talked about the coaches in the neighborhoods. I have a couple questions around that. One is, if I participate in the program, do I get someone that's the coach in my neighborhood? I know we're in virtual, so it's not as important right now, but the coach in my neighborhood or the coach in my doctor's neighborhood?
It would be, yeah, you'd be assigned to probably your neighborhood where you live. Yeah,
right.
that would make sense. But right now everything is virtual, but at the point when we go to in person, it would be by your neighborhood would make the most sense. Yeah.
Are you starting to talk about going in person yet, or still kind of just saying, let's do it this way?
Yeah, we're on kind of in a holding pattern. I think we're doing virtual for sure to the end of March, and then we're going to see for April. Yeah.
I mean, it seems like it's been quite successful virtually.
Yeah. No, we've actually had some really good outcomes, obviously, running it virtually. Yeah.
So maybe it's one of those hybrid things where it's how do people want to access the service instead of maybe there's value in having choice for people. I don't know.
Mm-hmm. Yeah.
And then I guess the other thing is that you had coaches in. I know why this is. We don't yet have a PCN established in the Lougheed in the Northeast area. But does that mean that if I have my family doctors there, can I still access this service if I'm in Burnaby, and even though I'm in the Lougheed area?
In the Lougheed,
northeast corner, where we don't yet have.
I think I would have to sort of defer that to one of the managers in terms of access. I think it would be fine as long as they have a Burnaby family physician, although Lougheed isn't one of the neighborhoods we are served. We're not part of that neighborhood.
No, not yet. No.
Yeah.
And just so folks know, I mean, that's certainly a discussion, particularly as the plan for the Lougheed neighborhood builds out. There's quite a bit of expansion plan for that neighborhood in Burnaby. So certainly the PCN is talking about how they may expand into there.
Yeah.
There's a question about who makes a good candidate. How do you decide what a great candidate is, and is there anything that might preclude a good candidate?
As I said, usually it's individuals who have are there at risk for chronic health conditions. So they're either pre-diabetic, they again, weight, obesity, and overweight are certainly candidates as well. Anyone with, say, hypertension or cardiac concerns, high cholesterol, anything that would be any health concern that would be impacted by behavioral change, for sure, are good candidates.
And this kind of goes to a question that's in the chat about what's the biggest psychological barrier to weight loss?
Yeah, I think it varies, doesn't it? I think that's what's good about our service. We cover a number of different topics, and some are relevant to people and some aren't, right? So I think that's the strength of our service, is that it's very individual. And so people will take away from it what they need, depending on what their life looks like. Yeah.
It's really,
it's multifaceted, I would say, and individual. Yeah.
Yeah, really custom. That's what's great about the program, is this really, it doesn't give a blanket answer. It really customizes it to individual needs.
Yeah, because they're setting their own goals. Yeah, for sure.
Yeah, I see Veronica, one of our staff, and has answered a couple of my questions. Lougheed referrals, yes, definitely are accepted, but the UPC.
Oh, thanks, Veronica. Appreciate it.
Good to have her here. That's why, and the UPCC you do need to have a longitudinal relationship with the physician in order to be able.
Okay, so not urgent care.
And we know that's a challenge too. I mean, it's great. So ideally, it's people who have that opportunity, but we're always working really hard to find family doctors for people.
Yeah, it's an ongoing challenge for sure. Yeah.
So, and can you tell us just in terms of capacity, is the program at capacity, or is it?
No, we because we're running groups now, we've opened up sort of, and we've just hired some new health coaches. So no, we have room. That's why we're happy to take referrals, and we have groups starting usually about every 4 to 5 weeks ish, perhaps sooner if we have enough participants. So our plan is to have ongoing groups just running constantly. So
great. There's a question here. I think you covered this, but just as a reminder, what's the length of the program for folks?
So the way we've structured it now is our group format is completed in roughly about 5 to 6 months, give or take. And then individuals can join the monthly maintenance group for up to 24 months. So another 18 months they can, so 24 months we're open to having folks followed. 18 months of which is probably in that maintenance group, just to ensure that they've sort of maintained the gains that they've achieved.
Great. Excellent. Well, that's great. I don't have any other questions. Are there any other? Oh, there's there's a question about cost. This is all covered through. This is a referral, and so
yeah, it's all through the health
as long as
health service.
Yeah, as long as you're a Burnaby or a Canadian resident, then you're it will be covered without cost. That's it.
Yeah, in Burnaby. Yeah, for sure.
Yeah, great.
Yeah.
Well, thank you. Is there any, just before we leave, is there anything else you'd like to share?
No, thank you for the opportunity to talk about the service. I'm grateful to have the chance to highlight all the great work that clients and coaches have been doing.
Well, it was really great to have you here, and I do want to remind folks that yes, this will be available through the BurnabyPCN.ca website, and certainly if you talk to your family doctor, it's highly likely that your doctor will be well aware of it. But if they weren't for some reason, we could certainly try to make sure that they get the information that they need. But Burnaby doctors are quite aware of it, and so if it's something that's valuable to you or you think would be valuable to one of your friends or colleagues or relatives, then please make sure you pass the word along. And again, I want to remind you, there are lots of other DOCTALKS and other resources on the BurnabyPCN.ca website. And so thanks everybody for coming. Yeah, thank you, Steph. I really appreciate it.
My pleasure. Thank you so much.
And we'll talk to you all soon. Take care.
Take care. Bye.
I know.